My name's Amit Choksi, partner at Florida Eye Specialist, cornea fellowship trained LASIK and cataract surgeon. And I've personally known Dr. Maida since I've been in town, probably early 2000, 20 plus years, and more professionally as partners in practice for close to 10 years.
Why did you, in particular, want to merge with Maida LASIK?
When we started our practice, Florida Eye Specialist, myself and Dr. Hassan were primarily the LASIK surgeons, and we had been doing LASIK in Jacksonville for probably early 2000s when we first came to Jacksonville. Myself at University of Florida, Dr. Hassan at Mayo Clinic. And when we merged our practices as Florida Eye Specialist, we continued with LASIK. And we were always collegial with Dr. Maida and his practice, but for years and years, Dr. Maida's practice regarding LASIK and vision correction has been known as the pioneers in this area that not only brought LASIK into Jacksonville, but were always on the cutting edge and really always provided excellent patient care, patient outcomes. And as we were trying to build our practice, and Dr. Maida was slowly starting to kind of wind down, so to speak, we always had some conversations about potentially merging our practices. And really, in my mind, that was a win-win for both of our practices. Number one, being able to share patients with Dr. Maida has been a true blessing. The amount of care he's given to all of his patients, not only to correct their vision, but really to treat them like family and really see them throughout their vision journey, has been very impressive to see, and a true role model and inspiration for not only my practice, but I can tell for my colleagues' practices as well. Thankfully, one of the best decisions we made was to decide to merge with Dr. Maida's practice in 2016, and really that has allowed the strengths of Florida Eye Specialists with the strengths of Maida Custom Vision to merge in a very cohesive unit, and I think has become really the premier place to get LASIK and really vision correction in this region.
Given the fact that you've been able to work with him for several years now, is there anything about working alongside him that really stands out from other providers or people you've collaborated with in the past?
Dr. Maida is amazing. He is truly, I believe, one of a kind, physician, person, surgeon, friend, mentor. There's so many qualities of him personally that I've got to know throughout the years. And I would say, really the number one thing is he's always treats the patients like they're his family members, and he was really looking out for what's in the best interest of the patient. He's always behind the scenes, making sure that the patient is really kind of getting the best outcome, whether it be pursuing new technology or making sure the patient gets seen multiple times to make sure the outcome is exactly the way that he expects. And really this attention to detail, I think it's hardwired in him to be like that. I'm sure when he became a physician, that was always like that since day one. And even towards the end of his career, he's still very much in tune with the patient and what the patient's going to need. Not only from a medical standpoint or a surgical standpoint, but more really going on a journey with the patient, both emotionally and really making sure that the patient's needs are fully met.
You are known for LASIK, but you've also pioneered other procedures such as YAG and utilizing technology like wavefront. Why is it important to you to be able to obtain new technologies like that?
Well, I was always interested in being one of the first at doing new things. And when I started my residency, for example, a doctor took it hand, they lectured on a new technique where instead of doing the old-fashioned cataract surgery they did in the 70s, that was you attach a frozen probe to the cataract and pull it out, there was a new technique where you could actually put an implant in. So I was very interested in that. And if patient had the old-fashioned technique, they would have to wear these thick glasses that magnified everything 30%, and it was very, very difficult for them to be active. So when I heard him speak, a light bulb went off in my head. I said, this is something very new that I would like to do the rest of my life. And I was finishing my residency, and very few people in the country did that surgery. But I traveled around and found 4 that were very good. The best surgeon in the country, in my opinion, that was doing that procedure was Dr. Sheets in Odessa, Texas. So I said, Dr. Sheets, I'd like to work for you, and you don't have to pay me that much. He said, I don't need you, so I'm probably not going to pay you anything. So I said, I'll tell you what, I will work for you for a year, and you teach me everything you know. You let me sit by you every surgery you do, and every surgery I do, you sit by me and tutor me. So when I left there, I was an expert in the cataract surgery that they're doing today, 50 years later. And that was 1976. So that was just, an amazing experience. So I was one of the first doing the cataract surgery. Then the YAG came along, and the YAG was a laser that was used to treat a membrane that developed behind the lens implant in the eye. When you had a cataract, there's a membrane that would leave in place, and sometimes it would cloud. And I had the tendency, if I heard somebody was developing something, I would go work with them. So I heard that a Dr. Aaron Rosa in Paris was trying to develop a technique with the YAG laser, and this was 1981. I got on a plane, went to Paris, and worked with her. So I had the first YAG laser in town. And then I put the first bifocal implant in the state of Florida in 1989. Now, that's commonplace. So I was always very interested in new technology, but I'm really not known for that. I'm really known, I think, for pioneering refractive surgery and the LASIK procedure. Actually, in 1989, in February, I heard that there was a doctor in Germany that had a new technique to get rid of glasses. I was 22,000 myself, virtually blind without my glasses. So when I heard about this doctor in Berlin, I called him and I made plans to go work with him. So I went to Berlin to work with him in February of 1989. And we talked about the procedure that is world renowned today, LASIK and using the excimer laser. I saw a patient that had thick glasses like I did, and then after the surgery, the next couple of days, they could see good without the glasses. But when I looked at their eye, I couldn't even tell surgery was done. I picked up the phone and called my wife. I said, Sandy, this is what I'm going to do the rest of my life. I said, I can't believe it. She goes, are you crazy? Nobody else knows about this procedure. It'll never become popular. She goes, can you charge for it? I said, no, insurance doesn't pay for it. She goes, you're really crazy. So I came back, and in 1989, on June 3rd, 1989, I had my first excimer laser, and was the first in Florida, I think the 6th in the US with the excimer laser, maybe the 14th in the whole world. So I started working with it. And at the beginning, we couldn't do too many cases because it was so new. So I went back and forth to Shanghai, China to learn the technique and get better at it. And then I set up companies in Colombia, Peru, and Ecuador so I could bring patients over there to have the surgery. And I had bilingual staff, had a complete office in those countries. So I used to work here Monday, Tuesday, and Wednesday at that time, and then fly to South America Wednesday night, Thursday, and Friday, and Saturday, and did that for years. And then eventually, it got approved in this country. I tell you, the unique thing, even though I started working on this in 1989, the PRK part of the procedure didn't get approved in the United States till 1996, and LASIK did not get approved till 1999. So I did it before them, but we never had any patients. It was very, very difficult. So I was spending a lot of money to become an expert on the technique with almost nothing coming in. So it was very, very difficult. And finally, in 1999, after it got approved, we started seeing more patients. And I ended up doing a couple of thousand a year, and we made some of the money back that we lost. But at the beginning, it was very difficult financially.
What does excellence in eye care mean to you?
Well, some of that I've addressed, but what it means is the surgeon, number one, being very proficient at the surgery. I was never lackadaisical when I learned a new technique. I wanted to be the best of the best, so I always overtrained. So like, for example, with the LASIK procedure, I went to Shanghai, China, make sure I knew the procedure well. I went to South America. With cataract surgery, in 1976, I spent a whole year with one doctor developing the technique and becoming very proficient. So I always did more than I had to do. I wanted to be the best of the best. But it was more than just being an excellent surgeon. It was being very good to the patients, listening to them, caring them, and letting them know that you cared. And the staff, which I mentioned before. I had a patient call me. She had surgery about 30 years ago. And the staff said, "Dr. Maida, please come to the phone." And I talked to her, and she says, "I still see 20/20. You operated on me 25 years ago. I am still so happy." And then one day a patient came in here, and my first thought was, "Sarah, why is this patient seeing me? She's not here for LASIK." She said, "Dr. Maida, this lady begged for us to let you see her. She had surgery in 1982, and now she's having trouble with her eyes. Nobody could help her, and she would only see you, and I wouldn't take no for an answer." So I love that, and a lot of times see patients or take phone calls and try to help people that I took care of years ago. What you do, I hear so many patients. I went to visit that doctor, and I said, "Oh, did you ask him that question you asked me?" She said, "Well, I tried to ask him, but he was gradually backing out the door, and I felt uncomfortable asking him. He seemed too busy." So, I think you really have to spend a lot of time with patients, make them feel, let them know that you care and you want to get their questions answered. So sometimes Didi will knock on the door, say, "Dr. Maida, we have a phone call for you," and she's letting me know that I've been there a long time with the patient. But I enjoy that. That's why I still practice. That's the pleasure of medicine, being able to answer questions that some patient may not have been able to get answered before. So that and the staff, to me, makes so much of this type of business.
How did working in Tanzania shape your future job and goals?
Oh, when I worked in Tanzania, I was in Africa. I was one of 4 doctors for 300,000 natives. And I worked in the bush, so I lived in a tent for that long period of time. It gave me an extra sensitivity for people that had very little or were indigent. So when I first came to Jacksonville, I wanted to work in an indigent community. So I worked at Methodist Hospital downtown, and most of my patients were indigent on Medicaid, and I just loved working with them. I found they appreciated the care they got as much or more than anybody I ever worked with.
So why did you choose Florida Eye Specialists?
Well, choosing Florida Eye Specialist, choosing somebody to take over this practice was one of the hardest things I ever did. It took me about 5 years to find the doctors that I work with now. At one time, I was thinking of selling the practice to private equity. They pay a lot of money, but the first thing they wanted to do is change my staff. This staff is incredible. Didi has been with me 27 years, Sarah 26 years. I had one staff retire after 30, another one after 33. I think staff makes the practice. So when I looked, I finally found Dr. Hassan, Dr. Chosi, Dr. Shetty, doctors that really believed in patient care and staff, not only in surgical expertise, because a lot of doctors have surgical expertise, but I find very few in the whole country that really focus not only on the patient, but also the staff. So to me, the staff makes the difference in the practice. When people say, "Why do you feel like the whole practice is excellent and your results are so good?" It's not only the doctors and the equipment, it's the staff. And they say, "Why?" Well, look at LASIK. In LASIK, all the measurements that go into the computer come from the staff. If you have to change your staff a lot, then the results will not be good. Also, I love it when patients tell me, coming to your office is like going to a friend's house for a cup of coffee. This group, they had the surgical expertise. A lot of them came from Mayo. Hassan was chief of cornea, Shady chief of glaucoma, Kostic chief of plastics. So I was proud to work with them. And they had a big focus on patient care. And they were willing to keep my staff and take care of them and give them credit for 20 years of working with me. So it was very, very hard to find a group that was like them. I've been with them now 5 years, and I'm just so happy. Now, a lot of people ask me, do I feel badly giving up surgery? Well, I don't. I'm religious. In the Bible, Ecclesiastes said, everyone has a season. And I always wanted to stop doing surgery when I was at the top of my game. And even today, my hands, no tremor whatsoever. But when I was 75, I was the best I ever was. So I thought that was a good time to leave when I'm doing real well. And I've always had this agreement with Dee Dee. And I said, Dee Dee, anytime you feel like I'm faltering or not as good as I was, you let me know. Because I said, I want to leave before that. So I think it was perfect for me bringing the group in when I did when I was 75.
You know, you've obviously spoken a lot about your medical achievements. Are there any personal triumphs that you would like to talk about, such as with the Maida Mountaineers?
That's a good question. I think one of the most exciting things that I did, I never graduated from college. In my third year, I decided to see if I could get into medical school, even though I did not have the prerequisite courses. And I got accepted to 2 medical schools that I applied to. So to this day, I don't have a diploma from college, but I have 2 graduate degrees, and one from medical school and one from Wharton, where I got my business degree. So I'm very proud of that. And hobby-wise, I indirectly got into hiking and climbing, but the head of the leadership department at Wharton called me, and he said, Jerry, we're going to do a leadership trek to Everest. Do you want to go? I said, I can't go. I'm out of shape. I never exercised. So he said, well, we know your dad died at 53. It would be a good time to try to get in shape. So I said yes. So I went on my first Everest trek in 1999, and I fell in love with the trekking. And since then, I've been to Kanchenjunga, the 3rd highest mountain in the world, Kilimanjaro, places all over the world, but I've been to Everest now 8 times. The reason I really like Everest is not only for the climbing, but for the people. You don't see them unhappy. And so one of the reasons I go back is because I made so many friends with the Nepalese people that it's just a pleasure to go back and hike with them again or just be around them. I've been to 96 countries now, and I love traveling. I did a lot of traveling before the climbing because I was teaching a lot of different places. And then I was a flight surgeon in the service, and then I lived in Tanzania for a while. But I really enjoy getting around and traveling, so that has exposed me to a lot of different people. And I love meeting new people and learning about new countries. So that's been a fascination for me.
Are there any other comments or things that you wanted to say about your life or your career?
I think I've been very, very lucky in my career. As I said, my father died at 53, and for some miracle, I am still healthy at 80, and my 2 uncles also died in their early 50s. We've never had a male in the family that lived past 54. So I'm a little bit religious, so I think God is watching over me because I love what I do. I love my patients and staff, and I do everything I can to be good to people. So I think maybe that's why I'm still alive. I'm also fortunate to have a wife that's very loyal and 5 children, and they're all working very, very hard, and we have a very close-knit family. So I'm very proud of that. I've been very fortunate. It's fortunate for the family, fortunate for my staff, my career, and just so many accomplishments.